Welcome to the Babbles Nonsense podcast, where I'm your host, Jonna Grimes, and we're here to discuss any and all things, but especially the shit that I want to talk about. Because let's face it, I have a lot of shit to say. And after all, you are listening to my verbal diary. Let's get started. Welcome back to another episode of the Babbles Nonsense podcast. This is going to be a little different today. So I have a dentist with me. Her name is Meghan Darby. She is local to the Huntsville area. And you're probably wondering why I have a dentist on the podcast. Well, because I want to, and it's my podcast. So that's why we're going to do it. And I think it's interesting. I actually really love dentistry. People think I'm weird when I go to the dentist. I absolutely love it. And fun fact, I was almost a dentist once. When I left high school, I was like, okay, I really like teeth. I want to go into dentistry. But then I realized schooling was way too far from home. And I chickened out. So then I went into nursing. But Meghan Darby is a, like I said, dentist here in Huntsville. She works at Flint River Dental, and that's your practice.
It is my practice, yes.
And so she owns her own practice, and she has 4 things that she believes in of the pillars of health, and that is movement, food, exercise, and stress management. So we're going to dive right on into like dental health and things like that, and figure out like how she owns her own practice and being a woman-owned business here in Huntsville, because that's kind of the theme of the podcast so far is women-owned businesses. So welcome, Meghan.
Hello.
So tell us a little bit about yourself, like who you are, how you got into dentistry, fitness, things like that.
Sure, absolutely. I am a Huntsville native, one of the rare ones. So I went to Sparkman High School. I actually got into dentistry because I love to help people. Like, honestly, that's kind of what I really kind of pulled me in. I thought I was going to go to medical school, and I had so many female doctors say, hey, if you want to have a family and you don't want to like live at the hospital all the time, you may want to think about dentistry. And so I started doing more research, and from there it just kind of grew, and I applied and got in. So it was exciting.
That's crazy. So you were going to be initially a doctor. Did you have like a field of practice you wanted to be in that?
Yeah, I was thinking more like pediatrics, which is crazy because I like seeing kids, but if I did it all day long, I don't know that I would love it as much as what I do now.
There is that.
Yeah.
So how long have you been in dentistry?
Sure, absolutely. I graduated in 2007 and did a year of residency with the Air Force, and then served in the Air Force for 3 years, and then I went straight into private practice, which is unusual. I've never actually worked as a regular private practice under somebody else, so I've never been an associate doctor, but I just started with ownership right away.
You just went straight into it.
Yep.
You're like, let's just do this.
Yep.
Wow, that is brave. How did that even come about? Like, did you just have an entrepreneurial mindset and you're like, no, let's just do this?
So my goal initially was just to buy a practice of a doctor that was retiring, but I graduated in 2007, right? And in 2008, there was a big recession. So a lot of doctors could not retire and ended up staying on a little bit longer. And so when I needed to get out of the Air Force, it was just like there was nothing that was really great for sale. And one of my sales reps now just kind of introduced me to this little spot over in the Flint River area, over in the Buckhorn community out there. And it's we're kind of in a little public shopping center, and it's just been, it'll be 10 years in August, which is crazy. Wow. So, yep.
So you've been in practice 10 years. Mm-hmm. So what have you seen change in the dentistry world as far as like when you started to now? Like, do you see a decline in people coming to the dentist or actually an increase?
Well, I mean, Huntsville is a growing area. So I think that the statistics are, especially in Alabama, that people, especially in pandemic times, the people have not been going to the dentist in any sort of regular number. And as you well know, because you're a nurse, we don't do a lot to help our poor people here in Alabama. Our Medicaid, adult Medicaid actually doesn't cover any dental services. So there's a large population in our state that are just not served at all. At all. So, but I think probably the biggest change in private practice dentistry has been, number one, just the technology has just gotten so much better. I mean, I do pretty much everything digitally now. And there is no silver filling material or metal. I mean, I haven't touched that. It's all gone.
Thank God, because I had those silver caps when I was a kid. Yeah. And I'm pretty sure, and I hope he's not listening to this, but my dentist was lying to me about having cavities because I pulled them things off with some, what are them, Laffy Taffies or something. And I went to another dentist and they told me I didn't have cavities.
I'm sorry. I hear these things a lot, but it's one of those things I know.
But you talked about
there's a lot of trust you have to have in your provider. I will say that.
It's true. It is true. Yeah. And you talk about the indigent population here in Huntsville. So there was a question on Instagram talking about uninsured patients and how we can help in the dentistry field and how we can get those covered. Do you have any suggestions for people not only in Huntsville but maybe listening to this podcast elsewhere, how we can get uninsured patients seen by dentists?
Sure, absolutely. So there are a lot of people that I would say self-insure, that just for them it's not worth it to pay out of pocket for dental insurance, because dental insurance is more like a coupon card. I tell people all the time it's like your Costco card. So you know how you go to Costco and you think like you're getting such a great deal, but every time you go to check out, you're paying like a crap ton more money than you thought you were going to be paying. So just know that dentistry is expensive, even if you have insurance. So even people sometimes that are insured have difficulty, meeting the needs of their family, which is why prevention is so important. Right. But here specifically in Alabama, we just don't have there are not many like state sponsored resources for people in need. Yeah.
So I know in Huntsville have the free dental clinic. So I don't know if anyone out there not listening in Huntsville has this option or maybe could develop this option in your town. But I know you said that you volunteer at this free dental clinic. And so what goes into that? Like how can people, do they have to be like uninsured and like a certain income?
So the Huntsville Community Free Clinic is it's a nonprofit here in Huntsville, and it's right on Whitesburg, so it's really close and pretty convenient to most places like that. You just have to be an uninsured resident of Madison County to go to that clinic, and you're eligible, I think, if you're 2.5 times whatever the poverty level, and they'll ask you to bring, either some sort of proof that you're a resident of the county and things like that. And so the bar is pretty low. I think that they even try and get people in if they can't. We do primarily just do extractions.
Okay.
But a patient that needs to have an extraction, can pay, like, depending on where it is, like up to $500 for one tooth. Wow. So if you're, somebody hasn't been a dentist in a long time and you need a lot of teeth extracted, it can be an overwhelming burden. So I'm glad that thing is optional, because as those patients go to the ER then you can't extract a tooth at the ER.
And they think it's crazy because they think we can. They come to the ER because they think that we could pull their teeth, and we're like, hey, we don't have the equipment. We're not dentists. Like an ER doctor is not.
No,
I would not want an ER doctor pulling my teeth. I'd be like, no, let's not do that.
I would say it's a skill that takes some time to learn, and so it'll be a much more pleasant experience for everybody if you go to somebody that's got those skills.
That's true. Yeah. And so we talked about the uninsured and the indigent population, but you said a minute ago that something I thought was great that you said was preventative care can help cut down the cost. For sure. So, and you're talking preventative care such as like doing your 6-month cleanings and things like that.
Yeah, absolutely. And for people that are not insured, my office and a lot of offices, I'm not special in that sense at all. We've got like a membership program or a discount program for people without insurance. And so you can go 1 or 2 times a year for a pretty reasonable rate, and then you get discounts if you need a filling or something like that. So, I think that constant care it helps prevent big problems, because the majority of the expense at the dental office is really on neglect and not new problems. Sometimes it is, or we can catch things when they're small and fix them. It's a lot easier and less expensive.
Because I was wondering that, because I know that there's a lot of people, like I know my sister talks about needing to go to the dentist, but she doesn't have dental insurance. But I try to tell her that I have seen signs for dentistry saying, like you said, like if you're self-pay, then you'll get a discounted price if you come in to get your teeth cleaned and things like that. So I think that's something we have to do better at advertising.
Yes.
And I don't know how we can get that word out, but I will definitely try, like, especially in the ER, that would be something to share with our patients. Like, hey, like these dentists here in town offer special prices. You may want to check them out.
And most offices that are private practices have some sort of membership plan to kind of help with that, for sure.
So what is your clinic mostly about? Like, I know you're private practice, but you said something when I was talking to you individually about sedation dentistry. What is that?
So we just employ like oral conscious sedation, which is a minimal we do minimal to moderate conscious sedation. I was IV certified in the Air Force, but I don't really employ that very much in my private practice now, just for ease to patients and cost reasons and things like that. But basically, for most patients, they will remember bits and pieces of the procedure procedure, but not the whole thing. And they will, sometimes patients will sleep through sometimes they don't sleep, but usually they've got some amnesia from the benzodiazepines that'll help, knock everything out. So when people come in and they say, oh, I'm so nervous, I can't get through this, I'm like, well, we have drugs for that. That's what I always say. Yeah.
Is it for cleanings too? Like if people are just scared for cleanings?
Generally we'll just sedate patients if they need a lot of dental work to be done, if it's a longer procedure. And for cleanings, usually those patients will kind of go into where we'll do nitrous oxide.
Is that the laughing gas?
Yes.
Oh my gosh. I've had that before. And every time I get it, I have my hands on my chest. Cause what do you do with your hands when you're laying in a dentist chair? And I'm like trying to lift them every time, cause I can feel myself getting heavy, and I'm trying to lift them. And then I just start laughing uncontrollably. And the dental hygienist is like, maybe I should turn this down.
I know.
Because I can't stop laughing and she can't even get anything done.
That's so funny.
It's so true though. So obviously we're talking about dentistry and our dental health. How does that affect the rest of the body though? I'm a nurse and I understand that, which most of the public population does not know that your teeth actually has a big deal on your health, heart, and things like that. So how can we explain that to the listeners today?
Sure. I won't go too deep into periodontal pathogens because that's not a lot of fun to talk about, but there are a lot of bacteria is like in your mouth is like, it's no joke. Like it's pretty much one of the dirtiest places in your entire body, which is crazy to think about, but it is. It has a lot of bacteria, and the type of bacteria that makes your bone kind of degrade around your tooth. I mean, believe it or not, most of the time I'm doing dentures on a patient, it's because of periodontal disease and not because of cavities, believe it or not, because they've gotten to the point where they haven't been to the dentist in so long, their bone is starting to degrade around their teeth, and their teeth kind of will get loose, and that's what you're trying to prevent. And so when you see those advertisements for like toothpaste and stuff that says like, oh, there's gingivitis. Well, gingivitis is just like red and like bleeding gums without the bone loss, and periodontitis is the bone loss too. So that bacteria has been there longer, so now it's killing all the bone. And I say that because those same bugs that kill the bone around your teeth will also make it more difficult for you to control your blood sugar, believe it or not. It makes your A1C higher. It also makes it hard for you to control your blood pressure. And you were talking about infective endocarditis. It can cause some pretty serious heart conditions and things like that. So, it's not a joke. And it's a chronic problem. It's not a painful problem, but it definitely, if any other surface of your body was bleeding, you would actually like go to the doctor and ask like, why is my arm bleeding all the time? I can't get it to stop bleeding. But people's gums bleed all the time when they brush their teeth, and that's not normal.
No. Yeah. And I know I have some little elderly patients that come into the ER, and they're like, if they talk about having a dental procedure, they're like, well, I was on these antibiotics because I had to take an antibiotic before my procedure. But people don't know that. They're like, well, why are they taking antibiotics? Well, because they have bacteria in their mouth that can go to their heart, and if they have like atrial fibrillation and things like that, then they're trying to prevent that. Their cardiologist is. Yeah, absolutely. And so I think that's very important that people know that if you don't keep your teeth healthy, then your body can become unhealthy, because I'm very into fitness and health, which I know you are as well. And what can we do other than the obvious of brushing your teeth and flossing to help keep our teeth as healthy as possible?
That's probably the biggest thing. Of course, I know nobody flosses. I think it's something like 90% of people don't floss.
I'm weird. I floss like 3-4 times a day.
I know. Once you start, it feels really disgusting.
It really doesn't.
But honestly, it is almost better than brushing, believe it or not. It's like the cheapest way to keep your dental bills down. I'm not kidding. And I'll say that, and everybody's like, I don't want to floss. I'm like, there are so many different ways you can do it. And I don't never say it to like make anybody feel bad. It's just that, I know you've got more things to spend your time and your money on than coming to see me more often. Yeah. And so, it's just kind of that kind of thing. As far as other prevention tools, definitely drinking a lot of water, and specifically being very, very careful about not only sugar, but also acidic beverages. So, I know coffee actually is not acidic. Coffee and like unsweetened tea are great. They do stain your teeth, but they don't, they're pH profile is very neutral. Okay, good. But things, believe it or not, like my LaCroix water that I love.
Are you serious?
But
I love LaCroix.
I do too, but it's pretty acidic. It's like it's not quite as acidic as like a Mountain Dew, but it's very acidic, and so it can cause sensitivity and erosion over time. Yeah, for sure. So you can't just drink just that all the time. Yeah. And of course, we're all having some wine too, and some other things like that. So those are all really acidic. So the point is just balance, just making sure that you're not writing checks all the time without putting any deposits in too. So you've got to do, we're all going to do some fun things. And now that, COVID's getting a little better, you can actually get around and see people and do things. So you're going to go and have some fun. But the point is that your basic habits need to be restorative and not depleting. Yeah.
So what happens Because sometimes, like, this is going to sound crazy. Like, okay, you've had a fun night, you've had a couple mini tube cocktails, and you go home and you're like, I really don't want to brush my teeth before bed. But I mean, I always lay down and then I get up because I'm sitting there constantly thinking about it. What happens if you don't brush your teeth before bed? Is that worse than just not brushing your teeth? Or is that just a myth?
So we do say, like, the most important way to brush, believe it or not, is 2 minutes twice a day with an electric toothbrush, because it just makes it targeted so that you're not missing any areas. Right before bed is the most important because you have less salivary flow at night, and so you'll kind of wake up and your mouth's kind of dry, and that's why you get that kind of morning breath. A lot of times it's because your mouth is really dry overnight, and we know from research that saliva is so important because it buffers. It's like, I'm using all my chemistry words, but buffering just means like it makes your negative pH in your mouth, your acidic pH, it kind of brings it up to an area that's more neutral. And we don't it's not just for like erosion why we don't want acidic beverages and stuff. It's also because the bacteria in your mouth that make the cavities, they kind of thrive in that environment. So they love it when it's like under about a 4 or 5. So they get really active then. So your bacteria are also like, they love to eat things that are at that pH. They thrive there. So you're trying to kind of create an environment that's not as amenable to all that stuff. Yeah.
All right. So age-old question. Yeah. Something, fluoride or no fluoride toothpaste? Okay. So
this is my take. Believe it or not, when I was in the Air Force, I was like I had to watch the fluoride in our water at our base and stuff. That was one of my crazy jobs that I had. There's a lot of things like that. So, I think that from research, personally, I don't think fluoridated water is the end all be all because it's diluted down so much. It has to be like 2 parts per million, things like that. Okay. And my big thing to say is that if you are a high risk individual, and that is not like a term I made up, that's an ADA approved term. So a high risk individual is anybody that's on multiple medications to where they have dry mouth, or they have had more than 3 cavities in the last 2 years. And then there's some other things like if they got braces or something like that, they're high fluoride. So your risk association needs to be what we're really looking at when we're telling you, do you need fluoride or not? You know, if you're somebody that's never had a cavity and your diet's pristine, I know maybe 3 people in my whole life I've ever met like this, then no, you don't ever need any fluoride. But our life's just not like that, you know. So, you know, we kind of run around, we're eating on the go, you know, there's just a lot of inherent stressors of modern life that makes it very difficult to maintain dental health. So I just think that a little bit of fluoride is in your regular toothpaste over the counter is your insurance policy. Okay. It just really kind of helps things to go. And I will tell you, any patient I've got that's on high risk, if they've kind of come in and they've had a lot of cavities, they're continuing to get some decay, maybe because they're on medications or they've had some sort of weight reduction surgery, believe it or not, like stomach,
gastric bypass. Their vitamins.
They can't absorb vitamins correctly. So there's a lot of, even some gallbladder things and things like that can make it hard to, for your minerals to kind of really restore those areas of your teeth. So a high fluoride toothpaste, like a prescription strength, is really going to be important. You just want to make sure that you're only using a pea-sized amount. I think most people are using too much. Like a tube of toothpaste should last you like 6 months to a year.
Are you
believe
serious?
it or not?
Oh,
yeah.
Wow.
Yeah. So like the Aquafresh commercial with like the big, if you can't see, but I'm like making the big Aquafresh like swoosh, but you know, you really just need like a pea-sized amount of toothpaste, and then brush your teeth for 2 minutes and then spit it out, and actually don't rinse the toothpaste out of your mouth. So if you're using a little bit, that doesn't feel gross, I promise. But that extra little bit of fluoride, you're not ingesting it, but it just stays on your teeth and helps remineralize things a little better. And it does.
I'm learning so much today.
I know. And it also helps with sensitivity too. So
wow.
Yeah.
Okay. So because I just asked because there's a big trend right now, you know, there's all these trends that go around, and I know that sometimes we all have to, in the medical field, we have to like combat that. Yeah. How do you argue with this influencer on Instagram who does not have a dentistry degree, and you're over here like, well,
I know,
I went to school.
I know. And there's a lot of people that are very holistic minded, that are in like a very alternative health space that, I mean, if you just Google, is fluoride healthy, you're going to find a good bajillion articles and things that are going to tell you that it's going to kill you. But, you know, too much water can kill you too. I don't know. Yeah. I mean, it's one of those things. That's why I kind of go back to the pillars of health. Because if you're doing all those things, like doing all the restorative things, like I said, then you have a little bit more wiggle room and you're not going to be in that situation.
Well, I tried doing like a non-fluoride toothpaste for probably 6 months, and I kept getting that plaque build up on my bottom teeth, and my dental hygienist kept saying, what are you doing different? Like, because your teeth, like I normally don't have to clean this much on your teeth. And I was like, well, I switched to a non-fluoride toothpaste. And she was like, you're going to have to switch back because your plaque is building up so fast. And it's
so
true.
Crazy. It's true. And so, you know, I don't know. I'm really, I mean, I always tell people I love Jesus, but I really trust science too.
Yeah.
And so there's things that we just know from just decades of research, and fluoride is one of those things that does work. And I will say there are some bad things if you over ingest it, if your kids don't need it under age 2 because they can't do brush teeth and spit things out appropriately. They ingest it and things like that. So I think if you'll use the appropriate amount, you're not going to be at any risk of really ingesting any, and it's really going to stay where it's at. Fluoride varnish is great for patients that are sensitive or they have a lot of fluoride, because we just paint that on. It's like a prescription thing, and then it helps with sensitivity too.
That's really interesting. Yeah. And you said not to wash it off. So does that mean like no mouthwash afterwards?
Mm-hmm. Yeah, typically.
Because I don't use mouthwash, but then everyone's like, you need mouthwash. And I'm like, but is it a waste of money?
Yeah, kind of.
Okay.
Yeah. I don't know. We have some specific things that we will recommend it sometimes for periodontal disease for some patients and some things. But I think for your normal dental patient, use it if it makes you feel good. But I don't think it's not like a floss. I mean, you can't, floss is a make or break. Like you have to use it. There's no way around it. But mouthwash, it's kind of like, whatever you like. It's fine.
So I have TMJ, and I suffer from TMJ.
Super common.
And they always tell me not to chew gum because it exacerbates it. But then there's those moments where you just want to chew gum. Mm-hmm. But I'm so iffy on gum because I also know there's a lot of sucralose in it, which causes gases and bloating. Mm-hmm. How do you feel about gum being a dentist?
So I think that there are so many people now that have temporomandibular disorders, and they'll have that the clicking and popping, and I can make mine click. I won't because it's really disgusting. But I've been a patient for like my whole life. I've had surgery on it in my 20s before I even knew I was going to go to dental school. So which was not super helpful, by the way. We do know from research too that
it may or may not work. 50-50.
Surgery doesn't really work. Yeah, it doesn't. I mean, sometimes it does, but not very rarely. Yeah.
Yeah, because I looked it up when they were talking to me about it, and I was like, I don't feel confident in this.
Yeah, if you've got like a disc displacement, or there's some like congenital malformations that can happen in the jaw joint that can make things that can make surgery an option. But for most patients, it's really you're overusing and overtaxing your muscles and mastication, your chewing muscles. And so really tips and tricks to kind of help relax your face is really good. Believe it or not, like most of what we do is go over prevention, right? So yes, eating large sandwiches and bagels, yes, gum, that's because it's overuse of that muscle movement. Also clenching teeth is a big one.
I clench my teeth at night. I have to wear a night guard.
And then another one that people don't talk about and they don't know is that if you've got a patient with obstructive sleep apnea, they stop breathing when they're asleep, and they're actually grinding their teeth together because they're trying to open their airway, and because they can't get air in. So your brainstem just is like, holy crap, what's happening? I gotta breathe. So it's like grinding your teeth together to do that. So, and believe it or not, a night guard can actually make your sleep apnea worse. So we always have to get that checked out too, because we're like,
I don't think I have sleep apnea.
I don't think we do either, but
I've
so common, it's crazy.
Like
yeah,
10, and I also, because I went to an oral maxillofacial surgeon, and he told me it was the stress in my life, and so he actually recommended an antidepressant.
Really?
Yeah.
Yes, there are the tricyclic antidepressants can be used like off label for.
He was like, because he was like, are you under a lot of stress? And I was like, well, yeah, I kind of have a stressful job, and so he was like, you've got to sleep. He was like, you're not sleeping, you're clenching, and I never went on the tricyclic because I'm just terrified of them. Yeah. But he did give me some muscle relaxers to relax it.
Sometimes that'll break the cycle, and it's helpful for patients. Yeah. Believe it or not, Botox can work in the joint. I was about to
ask you about that.
Yeah. So, I think that it says that it works for like maybe 6 months is what I've seen in my practice. But it takes, your muscle of like your masseter muscle here or on your cheek is like, it's so strong. It takes, and it's a huge muscle. It takes like, I don't know, like several $100. It takes like $600 or $700 of like Botox wholesale to like kill it. So it's not cheap. And if we can't get medical clearance for it, it can be a lot out of pocket to do every 6 months.
That insurance would pay for that.
I know it's cost prohibitive. That's why now, I do it sometimes in older men that like, believe it or not, some people like get dentures and they still will break their denture because they grind their teeth so hard. Believe it or not.
Gosh.
You'll have to remake it over and over again. Yeah. So, that's where like Botox is really great because then you're
Do you know any like night guards I've had that I've broken
through? Yeah.
And I have the hard one, the hard palate one. It's insane.
You may need some Botox.
I know, probably. And it's only the right side.
Really?
That hurts, and it'll flare up, especially if I chew gum. So I try my best not to.
Yeah, I can't chew gum. Like I can't touch it.
It'll definitely flare up. But
Yeah.
you spoke about Botox.
Mm-hmm.
I know a lot of dentists in town do Botox and
Yes.
fillers. Is that
Yeah.
something you do or looking to do?
Yeah, we're going to start incorporating that probably third quarter this year. It's something that patients are asking for in higher numbers. So I do think that'll be something that we'll add to our repertoire here soon.
That'll be
yeah.
something like easy, one-stop shop, clean my teeth, give me
Yeah.
some Botox and filler.
Yep, absolutely. Whiten, just get it all
Why
to go.
not?
Yeah.
So I did have a lot of questions on the gram about teeth
Yes.
whitening. So we've got to dive into some cosmetic dentistry. I know that that's not something that you currently or you do.
Yes,
is it separate? Is it separate practices?
No, actually, believe it or not, there's not really like a
is it
specialty.
not?
No, it's not. It's all general dentistry, believe
How
it
did
or
I
not.
know
And there
that?
are some, additional certifications and continuing education you can do. But I've actually chosen to do the majority of my continuing education is in like surgical stuff like implants. I do a lot of implants and things like that. So it's not something that's like I've got a lot of additional CE training. You typically will do like 1,000 CE a year, but I mean that's just not one that I.
So you're telling me people who do veneers are just general dentists?
Yeah, usually, yeah.
I did not know that.
Sometimes prosthodontics, that's somebody that's gone to another residency to do like extra, but generally speaking, they're spending multiple weekends a month doing high level, very expensive CE classes. And I typically do that too, but just in a different
way.
Dentistry.
You like something else.
Yeah, I like something else more. So that's the nice thing about general dentistry is you can kind of tailor it to what you're interested in. So I tend to do a lot of like implant supported denture type things, and so which is not cosmetics, right? So so while we'll do quite a bit, but it's not like my special.
It's kind of cosmetic. I mean, it's just not the cosmetic that someone
Yes,
goes into
absolutely.
a dentist and says, "Hey,
I
give
need
me
12
them
veneers."
implants."
Yeah, yeah, absolutely, yeah.
But so veneers, I've kind of looked into this, not for me personally, but I've looked into it because I know some friends that have them.
Yeah.
And so when I first heard about veneers a few years ago, honestly, I Googled it. They shave your teeth down.
They do, yeah.
What? How is that helpful to your teeth?
Well, it's cosmetic. So, I mean, a lot of things we do to make ourselves look better are not like, I mean, a lot of the things we do is just crazy if you think about it. So I won't go into everything. So, but this is something else. I mean,
So how does that little nub not break off?
Because it's really, you're only taking off enough to like, it's like they're almost as thick as a contact lens, and it's the bonding process that makes it strong. Okay. So you're not taking much off. I mean, we're talking like 0.3 of a millimeter, not much. Yeah. It's just in the enamel. So you're bonding in the enamel. So you're not actually going into the inner layer like the dentin. So you're staying kind of on the enamel portion.
So what if your veneer falls off? Are you just going to see that nub?
And then you have to call your dentist on a Saturday and say, I need this glued back on.
Oh, wow. Well, that would be a reason for me not to go into cosmetic dentistry if I was a dentist, because I wouldn't want to be gluing people's veneers back on.
I know.
Like,
so that's the thing. It's like you have to be very careful who you put. It's all, I mean, it's like anything in any sort of medical thing. It's all about the treatment planning. Like it's all about the preparation.
It's not for everyone.
And it's not for everyone. Yeah. So it's the same thing in everything I do. It's like, it is. And we do several veneers, but it's in specific circumstances. They've got to have a good bite to kind of support, so they're not putting a lot of pressure on them.
Okay.
And they've got to just be designed correctly.
Okay.
And if they are designed correctly, they typically do last real well. But like I said, I always tell patients, like, it's just you have to decide how much dentistry you want to sign up for. And for some people, it's really, really important. A lot of people are on like tetracycline or something, so they've got extremely dark, like gray teeth, and the only way you can really cover them is with that. Or sometimes patients have like they don't get their lateral teeth, or so they have they have a peg lateral that looks strange. So there are a lot of people. I mean, I would say a lot of the implants I end up doing on my younger patients that are like around 20 is because they are congenitally missing a front teeth, and we're replacing a lateral that was there. So
I know she got hit in her front tooth, and it died or something.
Yep, I do a root canal. Yeah, I do. That is probably the most common reason I do.
Tooth,
that's the most common reason I do veneers personally. Is like to match it. Yeah. And so that is like a functional unit. So that's very different. And so I do a ton of that kind of stuff. But
that's rewarding too.
But it is. Yeah, absolutely.
They didn't plan on that.
No.
And they're just like, I just got hit in the face with a baseball. And my tooth is broken.
Yes. I mean,
fix this.
It happens all the time. Yeah. It's really kind of the most common thing I do. And I always tell people, I was like, your teeth are not a utility tool. Just use scissors, please.
So I know a lot of people get veneers because they're so white. They don't stain.
They don't. Yeah.
So teeth white. Do you do teeth whitening?
Oh
in
yeah.
your
We do a
office?
lot of it. Yeah.
So is there a difference? Because some people say yes, some people say no, in the difference in a dentistry whitening strength versus crest white strips.
Yeah, absolutely. Well,
okay.
I mean,
obviously.
Yeah, there is. There's a huge difference in the materials. So, I don't know. I'm a lady over a certain age. I'm like, I'm in my early 40s. So I don't get my skincare from Walmart anymore either. So I think at some point, what I was telling you before we started, John, is that like, anything will work if you're 25 and under. You literally can buy anything at the drugstore, and it will definitely whiten things up. A prescription strength product is really, really going to work. It's because the hydrogen peroxide that we use to whiten teeth, right? I mean, it's going back to chemistry. It is a very unstable chemical. So it has to be stabilized to work properly. And there's just a lot of cheaper materials that are going to be in your Crest White Strip versus like a prescription strength product. Yeah.
So is that something, because I've had professional whitening once, because I had Invisalign, and then I got like where those little clear beads were. I had stains around them, so they whitened them after. I'm not gonna lie, it was a little painful.
It is. Yeah, it can be.
Can that's something you sedate me for?
No. No way.
Well, damn, I tried.
No, it's okay. But there are some ways to help that a little bit. Like there are, you can maybe wear a fluoride tray for a couple of, weeks before you whiten. That can help. There's some other things like that. You start using like a desensitizer toothpaste to kind of help with things before you start. So there's some things you can do to help, but yeah, they can make some people's teeth extremely sensitive. Yeah. And not for long term, and it's not.
Yeah, no. It was only while it was doing it.
It's all reversible, and I should say, and it doesn't harm anything. Like it's a very simple. It's not a difficult thing, but it's.
I would just get these little zap feelings.
Yes. Yeah.
Like during it, and then they would just turn the light off and let that go away, and then redo it. But it was a little. It was bearable. Obviously, I would do it again. But. So you said the whitening is not harmful. Is Crest whitening strips harmful? Because I've heard that it takes away your enamel.
As long as you're not over whitening and you're not somebody that uses them on a daily basis, I think as long as you use them as directed, they don't harm the teeth. No. Okay. Yeah. They're pretty safe they're definitely pretty safe. And that's why, I always tell people it's not rocket science. If they're getting too white for you, just stop. You don't have to finish the whole thing. Just save them for later. Save some of your bleach for later. If it starts to be sensitive, you don't have to do it every night. Skip a couple nights and then go back to it. It'll work up to a certain point, But most prescription products just have like different stabilizers in it, and they have like maybe a higher percentage of hydrogen peroxide in it, like all the way up to 40% versus what you get at the store. It's going to be like under 10, but sometimes they'll, it's like anything else. They kind of like will tweak the numbers just to kind of like make it look like it's stronger and it works better. I don't know. It's just, it's all in advertising.
Yeah. And then someone asked me, is there any way to whiten your teeth naturally without like a product like Crest White Strips or going to the dentist? Is there a way to whiten them?
Yeah. You see all sorts of stuff. It's so crazy. So please, for the love of God, do not use baking soda and lemon. That is horrible for you. It will pull things off. Please do not pull charcoal together and scrape it. I've seen so much of that on Instagram. No, don't use the charcoal toothpaste. They strip your enamel away too. Yeah, they're not great for you. They're not regulated at all. And so some of them may be okay, but the particle sizes are pretty big, and it can cause a lot of.
So is baking soda toothpaste bad for you too?
It can cause a lot of sensitivity. I don't know. It may be okay in small amounts, but a lot of people I'm saying that because a lot of people find a recipe on Pinterest and they make it and they start doing a paste and all this stuff, or they'll put together their own paste with a hydrogen peroxide and baking soda. I've really seen it all.
Well, yeah, TikTok trends are insane, and people are trying to get famous. Just trying to do something stupid. Your tooth falls out, and they're like, "Oh, here I am! I'm famous off TikTok."
Oh, good Lord! I know.
It's funny though.
It is funny.
And then I think that was all the questions I had, but I had a fact for you that I wanted to see if you knew, because when we talked about this, I just kind of Googled some stuff. Did you know that only 34% of dentists in the U.S. are female?
I did not know that.
Yeah, I was like, wow. I thought we had already came a long way, but no.
No, I was in most of our classes now that are graduating are about half and half.
That's good, though.
It's really funny because a lot of the older male dentists that are teaching you are super, super misogynist.
I was about to say, because you grew up kind of in that era where you were just surrounded by men. And so you
particularly in the Air Force, in the Air Force.
And which makes you so cool because, like you said, you just got out and you're like, screw it, let's just do this. Let's just open a business. And that wasn't being done 10 years ago. All this femininity and feminist stuff was not around. So you were a boss bitch then. You're a boss bitch now, but you were really a boss bitch then.
It's been a lot of just God's grace. I don't know what I'm doing still half the time, but it's just, continual, just trying to continually improve. Yeah. for my patients. Yeah.
So I kind of wanted to just share some stuff that I did a poll on Instagram last week, telling them that I was having you on. And believe it or not, out of the 47 people that voted, only 26 said no and 21 said yes, that they'd like to come to the dentist. So shockingly enough, people do love to go to the dentist. But I did ask them if they don't like to go to please tell me why. So I got a few comments and some of them are funny. So I'm just going to read them to you. So one person said, it makes me claustrophobic. So is there anything that you can do to help with the claustrophobia of it?
So yes, I think that the biggest thing you can do is tell your provider that it's an issue, and if they just balk at it, you need to find somebody that'll listen, because really
it's a
lot of people, a lot of times it's just anticipating what's going on. So I certainly run a very busy practice, and I try to do interviews like this and present myself on social media so people will tell me, hey, I'm afraid. And so I can talk them through it and kind of get them through it.
Yeah.
So that wasn't really an answer. The other thing is that a lot of times if you have an airway issue, we kind of talked about airway before, if you don't have a lot of, space in your neck and things like that to breathe, like you really are just set up to where you definitely feel like you're going to can't breathe. So if you're having like transient nasal obstruction where you can't breathe laying down, that may be the time to bump your dental appointment out a couple weeks if you really can't breathe through your nose. If you chronically can't breathe through your nose, you need to go to the ENT and get it fixed, because a lot of patients feel claustrophobic because they can't breathe. They're chronically only breathing through their mouth, they lay down, they can't breathe at all. Yeah. So
that makes sense.
Yeah.
Like,
so
I didn't even think about that.
Yeah. So if you're like the big thing is just communicating it so we can give you more breaks,
Okay.
Yeah.
Okay, and another person said, I almost died there way too many times.
Oh, no.
And it's painful. That's all she said. We're not going to comment on that. And then someone said, I don't hate it. I used to love it, but I feel like no matter how much I floss or brush, I get cavities.
Sure. I know it can feel really, really overwhelming. I do. And that is kind of why I talked about prevention earlier when you're a kid, because I'm telling you, if you can graduate high school without any cavities, the most of the patients I am working on had tons of cavities when they were little, and then they turned into crowns, and they turned into root canals, and they turned into extractions that need implants now, or they don't have insurance and they don't have a job, and they get so overwhelmed that now they need a denture. That's what it's all really, really about prevention. Yeah.
I completely agree with that, because like I said, I thought I had cavities and I didn't. So here we are.
Yay.
Everything is so expensive, even if you have dental insurance, but you talked about that, about if you go early and prevent, then you won't have to spend so much.
Right. Yeah. And dental insurance is expensive. I mean, dental work is expensive. My overhead is expensive. Everything's
I was going to say, maybe they should work on that. Because they treat it like a luxury versus a need.
They do a need. Yeah. I don't know.
Not you. I'm just saying, like, the government.
No, you're right. I do think that a day will come when dentistry will be under medicine at some point. I do think that day will come. Yeah.
It should. It definitely should, because think about it. It's if you break your face and your jaw, your insurance is going to cover that, and it's going to cover the cosmetic procedure as well. So why not cover dentistry?
And all especially here in town, all of the extra healthcare costs that are being used by neglect, that people just generally, they don't have the money to get it done. Agreed. So yeah, absolutely.
And then someone said, they always find something no matter how well I brush or floss. Well, maybe you're not doing it good enough. Yeah. I'm just kidding.
And so, kind of when you talk about like health and fitness, and what we're talking about too, is that, it is not a sexy topic, but maintenance is really important for all of us, because we're not getting any younger, and you really need to have good, just basic habits to maintain things. And your mouth is like a car that's got to last till you're 90 years old. You can't trade it in. You can't get a new one. You have to be committed to long-term maintenance. And that is not a fun thing for people to hear. They're like, people will come in and they'll be like, okay, but you're just going to fix it. I mean, like, everything I do has got a lifespan. Everything I do, the more you can do at home will make it last longer generally, but you just have to be committed to maintenance.
Well, I say that to my patients all the time. Like, they'll come in with high blood pressure or diabetes, and they're like, well, I want you to fix it. And I'm like, there is no fix. Like, you kind of already went that route, and there is no fix at this point. Yeah. And I know it's hard when you're younger, because you're invincible and you don't gain weight and you think you're healthy. But then when you hit 30 and 40 and things are starting to happen, you're like, oh, I wish I would have listened to my mother.
Yes, that is true. That is true.
Then I had one that said, the sound of the tools in my mouth is petrifying.
Yes. So I would bring headphones
Oh,
and
that's a good
find
idea.
a podcast or a music you want to listen to.
I
know there are some places that have TV on the ceilings, and with COVID, we can't give you your own headphones. So please bring something. Yeah, that will take your mind off the stuff. And to be honest with you, often my assistant and I have just stupid banter the entire time, and I'll apologize. And they're like, "No, you're just taking my mind off of it." So
that's good.
So just ask your dentist to cut up.
Yeah,
over
just
your head.
bring those headphones and listen to the Babbles Nonsense podcast.
Yeah.
Shameless
There
plug
you go. Yeah, absolutely.
And then someone said in agreement to that, I hate the drill.
Mm-hmm.
And then one of my good friends who is hilarious put, it's boring. But then on the next one where I put, do you have any questions for the dentist? She said, not a question, but my apologies for saying it's boring.
No, it is boring. Imagine if you had to be there 40 hours a week like me.
And then the 3 other questions that I got for you were all about whitening. And I think we touched on these, but I'm just going to read them just in case I didn't. Do crest white strips work? Are they safe? Because they make my teeth hurt.
Yeah. So yes, like we talked about that before. So just take a break between them. They're not going to hurt your teeth. They're not as effective. So if you're not getting the results you want, that's okay. The only other thing that I didn't mention earlier is I'll say that whitening toothpaste are not helpful at all. They just have abrasiveness in the toothpaste, and that can make some patients sensitive. So if you have sensitive teeth, I definitely wouldn't use a whitening toothpaste, and don't expect it. It just removes very minor surface stains, but it does not whiten. Yeah.
Well, and then my friend said teeth whitening hacks, which we kind of went over. And then what is the best way for whitening the teeth? Is it a UV light or baking soda?
Yeah, no. And to be real clear, like the light, it's the chemical in the whitening agent, not really the light.
Oh.
So you're probably we like use core whitening, and it's expensive because it's expensive for me. They fly it on dry ice from the manufacturer in California. Like it works really well in tough cases, but it's just, I'm sorry, what was I saying? I lost my...
The UV light in the medicine.
Oh, yeah, but the light is not... Yeah, the light is not magic. Yeah.
Okay. So one other thing I forgot to ask you earlier before I went over the questions, and you said you do dentures. Mm-hmm. Have those came a long way versus what they used to be? Like, can you make them more like smaller, and is the technology better on the denture portion?
Well, if you've got a good denture tech and you're working with good communication with your doctor, I mean, honestly, you shouldn't be able to tell that somebody's got a set of dentures. Okay. And, the hardest thing is that, you're taking something that is hard, like your teeth, where you're used to chewing and like normal, and you're putting all of that on your gum tissue. And patients typically only get like 20% of chewing force that they would with regular teeth with a set of dentures. So that's why like implants are really good to help like save them in. But we can do full arched implant cases where we put 4 to 6 implants in, and they've got a prosthesis that's in and that doesn't come out.
Okay, so you can make implants like dentures, but like they're all just implanted?
But they're all just implanted, yeah.
Oh,
yeah.
That is awesome.
Yep.
That is awesome.
Yeah.
Well, I appreciate you so much for doing this.
Again, prevention is way cheaper than that.
That's true. Yeah. But I really appreciate you doing this because I know I'm a nerd, but I really do like going to the dentist, and I hope everyone out there learned something. And if you have any questions that we did not touch on, please send me or Megan a DM, sorry. And where can everyone find you on the social?
Yeah, absolutely. My Instagram handle is at Dr. Meg Darby, and my office is at Flint River Dental.
All right, guys. So if y'all are in the Huntsville area and are looking for a dentist, hit up Megan at Flint River Dental. Yeah. And until next time, bye.
Bye.